Hi, it's Dr. Jennifer Neff. I'm back and I'm ready to talk about pesticides today. So often in the office when I'm taking care of patients, they'll come in with trouble losing weight or fatigue or difficulty with symptoms that don't really add up to a diagnosis. And I like to talk with my patients about health and wellness. So we talk about exercise. Are you exercising? We talk about diet. Are you following a healthy diet? And many of the folks that have those symptoms, they actually are. They're exercising. They're following a healthy diet. And so my curiosity was piqued, and I sent my scientific nerdy brain to the research place and started researching. Okay. What I find is that a lot of these symptoms that I'm finding that are non-specific and not leading to a particular diagnosis may have a lot to do with pesticides in the food. So I want to talk about the three things that I found during my research that surprised and frustrated me. Okay, so the pesticides are sprayed on the food so that insects, don't eat them. Now, they tend to disrupt certain things in the insects to make the insects die, but they also disrupt things in the human body too. And the things that were standing out for me is that the pesticides by and large are hormone modifiers. And the way that they modify your hormones is they mimic estrogen. So estrogen is a female hormone, but men have it also to a much lesser degree. And what the pesticides can do is act in your system as if there's more estrogen than there should be, which would lead to things like weight gain, which can lead to hormonal changes, and which can also lead to mood changes, can lead to the way that your body metabolizes in a different way. And that was significant to me. The other thing that I found out is that pesticides can disrupt the good bacteria that live in the gut. And the good bacteria that live in the gut, we need them there to help us with digestion, to help us absorb our vitamins, and to help us have a comfortable digestive process. The next thing, or the last thing, that was a little bit frustrating for me to find out is that they also cause difficulty with the making of the feel-good chemicals that keep you from being depressed and anxious, and especially tryptophan, which is a precursor for serotonin. And serotonin is that happy neurotransmitter that helps you feel not anxious, that helps you feel not depressed, that helps you feel excited and present and, the way you want to feel. So if the pesticides are doing this, then the next thing that I have to go thinking about is what can I recommend to my patients so that they're not suffering from that. Now, organic food is the way to avoid pesticides because if it's labeled organic, it cannot have been grown with pesticides. And because pesticides are what we call dose dependent, meaning the more you are exposed to, the more you eat, the worse it is. If you start moving some organic foods into your diet, then that's really going to be helpful. Okay. So some people say, where can I start? And there is a list that you can find online. It's called the Dirty Dozen. And those are the fruits and vegetables that it's more important for you to eat organic. There's another, I think the list is called the Clean 15. And those, it's less important for you to have organic. But personally for me and for my family, I try and do as much organic as I can find. Okay, so the Dirty Dozen is thin-skinned fruits and vegetables. I think kale is on there, apples, strawberries are on there, and those would be things that you would really want to look for organic because like you think kale, oh, it's super healthy, but if the kale is sprayed with pesticides that are going to disrupt your hormones, that might not be something that you want. Okay. So what I also am very excited about is the power of the internet and the power of people's choice. So if you are asking for organic foods to be available in the places where you shop for foods, organic foods will become more available. And so I want you to use the power of your voice and your choice to go out there and help yourself feel a lot healthier. That's it. Until next time, see ya.